Hello everyone, myself Dr. Krishna Badal. I am a faculty of Department of Medicine in Asia International University, Bukhara, Uzbekistan. So today I am going to discuss some past year MCQ of FMGE exam, okay, in medicine. So let me start. Let's start from question number 1. The murmur which is heard in aortic stenosis is which of the following? Okay. Now, how to solve this type of MCQ? So, in aortic stenosis, which is a type of valvular heart disease, here the aortic valve is narrow, and aortic valve is a type of semilunar valve. Semilunar valve, which is narrow. Okay. So, of course, the murmur is most loudly heard in aortic area, and aortic area is present on second intercostal space on the right side of the sternum. Right side of the sternum. Remember this. Now, this murmur is a low pitch murmur, but very harsh one. Okay, it is a harsh quality and it is always radiates towards the neck or towards the carotid artery. So now let's find out which is the correct answer here. Right second intercostal low pitch murmur. A is the correct answer here. All other options are wrong here. Okay. The pansystolic murmur, is heard in different conditions like mitral regurgitation, tricuspid regurgitation, and VSD. So all others are wrong option. Let's move on. Question number 2. In coarctation of the aorta, the site of rib notching is, first, what is coarctation of the aorta? Okay, coarctation of the aorta is a type of congenital heart disease which is of course very commonly present in children, and this coarctation of the aorta means the arch of the aorta, okay, the arch of the aorta, okay, after the origin of left subclavian artery. Left subclavian artery is narrow. Okay, you need to understand this first. So it is acutely narrow. Okay, so after that what happens? Let me draw a very simple diagram here to make you understand. Okay, now this is brachiocephalic trunk which has two branches, right subclavian artery and right common carotid artery. This is left common carotid and here is left subclavian artery. So after the left subclavian artery is originated, okay, right here, okay, let me draw again. Here, okay, there is the problem of coarctation of the aorta. Now the blood which is going to the lower limbs and lower part of the body is very less. Okay, as a result of this, a compensatory mechanism will be activated in the body and there will be formation of collaterals. Okay, these collaterals, okay, will have more amount of blood flow all the time, and because of this excessive blood flow they will cause some indentation on the rib, and usually the inferior surface of the rib, okay, is indented, and that is called rib notching, which is very commonly seen in chest X-ray. So this is the answer here. Okay, let's move on. Number 3, the cardiac marker earliest to rise is which of the following? Now what are the common cardiac biomarker? First, the common cardiac biomarker are CKMB, troponin, okay, troponin I and troponin T, and these are the most common one, there's no doubt about it. Even myoglobin can be measured. SGOT is one of them and LDH is another one. Okay, so these are some more, but from the clinical practice point of view, this CKMB and troponin I and troponin T are very commonly done, and the earliest one among all of these is troponin I. Okay, and this is the most specific cardiac biomarker in case of myocardial infarction. Cardiac biomarker in MI, acute myocardial infarction. Okay, so please remember, this is very, very important question. Now I have collected one table. This table, see this, CKMB, troponin I and troponin T, and even myoglobin can be done, but which is the earliest to rise? Okay, troponin T is not given here, only troponin I is given, and it elevates around 3 hours after the myocardial infarction occurs, and mean time to peak is 24 hours, and within 5 to 10 days it comes back to the normal range. So that's why this is the answer here. Now question number 4, hypotension with muffled heart sounds and congested neck vein is seen in which of the following condition? Now hypotension with muffled heart sound and congested neck vein is a typical feature of Beck's triad. This is called Beck's triad. Okay, Beck's triad is a combination of hypotension. Hypotension means decreased blood pressure. When the systolic blood pressure is less than 90 mm of mercury, we call it hypotension. Second, okay, is raised JBP, and 3 is muffled heart sound during auscultation. This is called Beck's triad, and if Beck's triad is there, of course the diagnosis is cardiac tamponade. A, cardiac tamponade is the answer. Okay, in none of the other condition the Beck's triad is seen. So this is very important question. And remember, what is the treatment of cardiac tamponade? Okay, the cardiac tamponade, only one treatment is available or effective, and that is pericardiocentesis. We need to remove that fluid, which is usually a blood. That blood should be aspirated as soon as possible, because it is tightly compressing the heart. Okay, and patient may die if the treatment is late. So this is Beck's triad, which I just discussed with you. Low arterial blood pressure, hypotension, distended neck veins, raised JVP, and distended muffled heart sound. Okay, this is called Beck's triad. Let's move on. Question number 5. Which of the following is given to decrease serum triglyceride? So this is a question regarding the therapy or the treatment, and this is a case of triglyceridemia, or increase in triglyceride level in the serum. And one of the commonly used drug, or the first line drug we say is fibrate. Okay, fibrate. One of the type is called clofibrate. Okay, and this is important question in many different exam. Clofibrate is commonly used. Statins are mainly used to decrease the cholesterol level, because it blocks the enzyme FMGE CoA reductase. Remember, this is another question which may be asked to you in some other exam, who knows. Niacin is also used to decrease the triglyceride level. It is also known as vitamin B3. Even omega-3 fatty acid can be used to decrease the triglyceride level. And ezetimibe is another drug which we take to decrease the cholesterol level. Okay, so one of the important answer here is fibrate. Okay, fibrate is the answer what they are looking for. So A is the answer here. So with this, let me end this session. We'll continue again. Thank you.